past and present history, and then I would inspect for any swelling, discoloration, or deformity, and then I would check the tibia and fibula here for fracture, and then I would also check the medial and lateral malleoli as well as the dome of the talus here for fracture. And then I would check the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament for sprain. I would also check the deltoid ligament, anterior, mid, and posterior for sprain, and then I would also check the tibia-fibular ligament here for sprain. And then after that, I would do the referred pain test so squeeze for fracture of either the tibia or the fibula, and then I would also do the calcaneal bump test, which is also checking for a fracture of either the tibia or the fibula. Next I would do the stress test, so starting with plantar flexion and inversion, checking the anterior deltoid ligament, anterior talofibular ligament, and then neutral and inversion, checking the calcaneofibular ligament here, and then dorsiflexion and inversion for the posterior talofibular ligament. And then for the deltoid ligament, I would so plantar flex and have them plantar flex and evert to check the anterior deltoid ligament, and then neutral and evert to check the mid deltoid ligament, and then dorsiflex and evert for the posterior deltoid ligament. And then after that, I would do the anterior drawer test here, and that is checking the anterior talofibular ligament as well as the anterior deltoid ligament. And then I would do the posterior drawer test, which is checking the posterior talofibular ligament. And then I would have them do yeah, I was right. Yeah. Okay. Then I have them do range of motion. So this would be done both actively and passively. Right now I'm just doing actively. So for starters, let's do dorsiflexion to 20 degrees, and then plantar flexion to 50 degrees, and then inversion to 5 degrees and eversion to 5 degrees. And then we would move into the resisted range of motion. So starting with plantar flexion, I'd have them come all the way up into dorsiflexion and go through full range of motion here. And so that is testing the soleus and the gastrocnemius as well as the tibial nerve. And then come down into plantar flexion and dorsiflex all the way up through a full range of motion. That is checking the tibialis anterior as well as the deep peroneal nerve. And then inversion, so I would start with them everted and have them pushed into inversion. And that is checking the tibialis posterior as well as the tibial nerve. And then for eversion, I'd have them come into inversion and push through a full range of motion here. And that is checking the peroneus longus and brevis as well as the superficial peroneal nerve. And then we would do the motor testing. So that would be plantar flexion and inversion is L4, and then dorsiflexion and inversion is L4, and then L5 is toe extension, and then eversion is S1, and then S1 and S2 is going to be plantar flexion. And then we do the sensory tests, so starting on the medial side, L4, and then L5, and S1 here. And then after that, I would do the Achilles tendon reflex test, checking S1, so I would push them all the way up into dorsiflexion here, and I would hit the Achilles tendon to try to make them plantar flex. And then after that, I would take a dorsal pedal artery pulse. I would do a recapitalization test to make sure the color comes back in within 2 seconds, and then I would compare bilaterally.